Hello, my friends. Here we are again for our Tuesday Q&A. I'm Dr. Clelia Lima, nurse practitioner, uh, family practice, specialized in sleep disorders and all the primary care diseases. So I'm happy to be here with you talking about, today we have talk about COVID, symptoms versus flu versus cold versus allergies. Because as you know, some of the symptoms, they overlap. And many people ask like, how do I know I have just an allergy or I might have COVID? So we're going to talk a little bit about that. And also we're going to touch on the new variant for COVID, the OMICRON. Everybody's talking about it. Everybody's just, concerned what's going on. And we'll discuss a little bit about that too. So to start, the other group was, we had questions about uh, if I have fever, what is um, the possibility that I have an upper respiratory infection that I can differentiate between COVID, flu, cold, or allergy. If you have fever, I can tell you most likely we're not dealing with allergies, because when you have allergies, you don't have fever. Body aches, it's not a symptom of allergies either. Diarrhea, nausea, vomiting, if you have those things, you know that's not related to allergy. Usually allergy is related to pollen. When the levels of pollen is too high, people tend to have the symptoms. And the symptoms pretty much is runny nose, postnasal drip. You may have like, because it's bothering your upper respiratory allergies. You may have some watery eyes, red eyes, itchy nose. Um, so the symptoms are very easy to differentiate from cold, from flu, and from COVID, because the symptoms are limited to the upper respiratory. So you're not going to see fever and the other symptoms with allergies. And usually people know they have a history of allergies, and they know when the spring comes and all the flowers blooming, they might have more symptoms. Sometimes you may have allergies to dust and other agents. So the recommendations is for you to avoid what may be causing your allergies. And you have, options of over-the-counter medication that might help with the allergies. I have allergies myself, and I know sometimes you have to change from one antihistamine to another because it works, and then in a few weeks it might not work anymore, and you change to another one and see which one is more effective at that time. So usually you can deal with your allergies without a consultation with a medical professional, because it's easy to control the symptoms. But if it gets too bad, you may need some prescription nasal sprays and other things that might help with the allergy. And sometimes you even need to go to an allergist to find out what's going on if it gets to be so difficult to control with the easier treatment. So allergies pretty much, has its own, symptoms that you can differentiate easier. Now, when talking about cold, flu, and COVID, they kind of overlap more symptoms. The common cold, usually you don't have high temperatures. You may have a low grade temperature, but not, too high. The flu and the COVID, you may deal with a higher temperature. And when you have fever, usually it gets to be very debilitating, because you don't feel well, and your body start aching too. You may have some headaches. And the other group, I had a question about how to deal with fever. And some people believe that uh, not taking medication for fever is the best approach because the body fights off the infection. Actually, there is no scientific evidence for that. Controlling the fever is the best benefit for the body to recover. So, taking a Tylenol, um, a shower that is not too cold but not too hot, it might help you to keep the fever down. And hydration, drink lots of water. If you have a fever going on, you want to make sure your body is well hydrated. So the flu and the COVID, you may have to use more medications to deal with the symptoms. If you have a mild case of COVID, you may not need any medical attention, or you may not even need to go to the hospital if you're a healthy person. But the best way to deal with COVID is not to have it. So we recommend the best line of defense is the vaccine, because your body's going to be producing antibodies to fight the COVID infection easier, or at least to avoid you being admitted to a hospital and getting on the ventilator, ICU, more serious consequences. So get your COVID vaccine. Now we have the booster available. So if you're eligible for a booster, go ahead, get your booster. I got my Moderna booster already. And it's always, a good idea to have the vaccine on board. For the flu, the same. Every year you have the flu vaccine available. And as we know, the flu vaccine is not as effective as the COVID. Usually the percentage for the flu vaccine is around 30-40%. But you know what? I would take 30% anytime over 0%. So whatever is available, I want to make sure that I take advantage. The other thing about the COVID vaccine, more and more studies going to be done to have the composition of the vaccine more effective to be stronger with the new variants, because we have seen from the latest studies that the COVID vaccine lose its effectiveness as the time goes by. So the booster most likely is going to be like the flu. They're going to be predicting what is going to be the next strain, and then getting the vaccine to be more effective towards them. I'm gonna jump ahead a little bit and talk about the Omicron, because this is being so much talked about in the last few days. So it came from South Africa, and the interesting thing about the origin of the Omicron variant is that in South Africa, less than 25% of the population in Africa is being vaccinated against COVID. And that's really heartbreaking, because they are not vaccinated mostly because they don't have the vaccines available to them. So many people want to have the vaccine, but they don't have access to vaccinations at this time. So less than 25% of Africa has been vaccinated. On the other hand, talking about the United States, we have barely 60% vaccinated. And that's such a heartbreaking to know that we have vaccines available and very easily accessed. Every corner you have a pharmacy with COVID vaccine available, but some people just don't want to get it for whatever reasons. We have been questioning the vaccine. They have been, so polarized about their opinions, and not listen to science, because if you listen to science, you will get your vaccine. And more studies have confirmed that they are safe and they are effective. And we just, that's the best thing to do. So the Omicron is a very interesting mutation of the COVID virus. The main thing that, has been such a a concern is because the mutation of this specific strain, it's too many in one genetic code. So it has more than 50 mutations in one strain. So it's too early to have any sure assurance how much the vaccine is effective, how the severity of the virus. I just had listened to a talk from the CDC and the WHO officials, and it's going to take another 2 weeks to actually have more information that we can rely on. Right now, it's too premature to make any assumptions one way or the other. So what we know so far from South Africa, the mutation has been attacking more the younger population. So the people that have had the Omicron variant are the younger people, the healthier people. So their symptoms have been very mild, like runny nose, cough, body aches, but very mild. I haven't heard any statistic about death or anything on those lines, but we don't know how this variant is going to behave with the older population, with people with immune deficiency diseases. And so it's too early to make any speculation about what's going to happen to this variant. So my opinion is, right now we don't know a lot about it, but I would respect, like I respect, the pandemic going on. Be very vigilant. What we don't know and we cannot control, there's nothing to do about it. But there are many things that we can do. First, get vaccinated. If you're not vaccinated, go ahead, get yours, at least the first dose, and do the whole thing. If you have already been vaccinated, get your booster, because that's what we have available. That's what's the best protection right now. And be mindful about the holidays. We just had Thanksgiving. It was wonderful to be with our families and friends. Now we just around the corner for Christmas. Many people are going to be traveling by airplane, by cars, or whatever traveling is you may be doing for the holidays. Just make sure that you protect yourself. Use your mask, wash your hands, make sure that you get your immune system well protected, eating well, sleeping well, doing good exercise on a regular basis. So some of the things we can do, but some things we can't. So I would say no panic, no changing your plans for the holidays, but just be mindful and be very vigilant about the protections that we know we can do. So as far as the difference between the symptoms, I just want to say something else about the difference between the flu and the COVID. It has a lot to do also with the duration of the symptoms. Usually the flu, in about 5 days, you get better, and the resolution of the symptoms is very noticeable, back to normal life. The duration of COVID symptoms usually takes at least 2 weeks, sometimes months. Some people have the long haulers and they stay with symptoms much longer. So those are very prominent symptoms that I would want to make sure that if you have any symptoms of fever, cough, body aches, headaches, nausea, vomiting, diarrhea, anything, go get tested, because that's the best way to to know if you have COVID or the flu, or you might have both, because it doesn't mean that you have one virus, you don't have the other. You could have both. So get tested and get yourself protected, and make sure that you are doing all the good measures to get through the holidays with a lot of celebration with your families, because one of the things that strengthens our immune system is to be well connected. And if you need any help, seek help, and just enjoy your families and your friends, and just be good to each other, and keep going, because COVID, it's here. It's going to be here for a while. The flu, we learn how to deal with the flu for many years. It's not going anywhere. Colds, we have had colds for many years. Allergies, the same. We have learned ways to deal with those virus, and we just going on with normal life, and just being very attentive to know the difference and what to do about it. I don't see any more questions. So next week, we're going to be here again every Tuesday. We have the Q&A. And please subscribe to my YouTube channel. It's very helpful to get this subscription. And please share with your friends so they can watch the Q&A later, and they can subscribe to get the latest information as well. You have an excellent night, and you be well, and I see you next Tuesday.